Description of the disease. Infectious mononucleosis, also known as mono, kissing disease, and glandular fever is a contagious illness typically caused by the Epstein-Barr virus. This infectious disease can be spread by saliva and the incubation period is 4 to 8 weeks. Pathogenesis. Infectious mononucleosis is caused by Epstein-Barr virus that is transmitted by contact with saliva in a susceptible seronegative host, lacks antibodies. The virus in the contaminated saliva invades and replicates within the epithelial cells of the salivary glands and then enters B cells in the lymphoid tissues, particularly tonsils, which possess receptors for EBV and cause infections of the epithelium. Inside the lymph node, there are lymphoid follicles and antigens displayed on the follicular dendritic cells. These cells recognize antigen and migrate to each of the follicle where they contact with CD4 helper T cells that provide activation signals. Activated B cells might bring back into the follicle and proliferate. Some of the B cells differentiate into long-lived memory B cells, while others become antibody-secreting plasma cells. These long-lived memory B cells serve as a lifelong reservoir for the virus. The infection spread throughout the body by the lymphatic system. Atypical lymphocytes is seen on an examination. Clinical manifestations. Clinical manifestation. Fever. Not surprising, happens in many infections. Pharyngitis. Cause of infection of epithelial cells in the pharynx. Lymphadenopathy. Cervical lymphadenopathy because cervical lymph nodes drain the pharynx and tonsils where the infection starts. But as we said, the infected B cells traffic throughout the lymphoid tissues of the body, so you can actually get lymphadenopathy everywhere. Fatigue. Normal when you get sick, but with mono, the fatigue is exaggerated. Atypical lymphocytosis. Normally, lymphocytes of the blood looks like this, but with a small nucleus and a very little cytoplasm. But in mono, you find lymphocytes in the blood that look like this, with a much bigger nucleus and lots of cytoplasm. We call them atypical lymphocytes, and what are they? They are reactive cytotoxic T cells that are trying to kill infected B cells. What does mononucleosis mean? It means there are a lot of mononuclear cells in the blood. And what are mononuclear cells? Well, they are WBC that do not have segmented nuclei, which neutrophils and eosinophils due the name mononucleosis. Refers that there are a lot of lymphocytes in the blood, but some of those, not all, are gonna be atypical. Splenomegaly. A spleen, you might know, has a lot of B cells, so inevitably infected B cells go. Diagnostic and laboratory procedures. Blood tests or blood smear. Mono is confirmed by blood tests. Early in the course of the mono, blood tests may show an increase in lymphocyte. Some of these increased lymphocytes have an unusual appearance known as atypical lymphocytes when viewed under a microscope. Monospot and heterophile antibody tests. These tests rely on the body's immune system to make measurable antibodies against the EBV. The test detects proteins in the blood called heterophile antibodies that are produced by the immune system in response to an EBV infection. Treatment modalities. Eat healthy diet. Drink plenty of fluids. Drink plenty of fluids to prevent dehydration. Get enough rest. Mono makes you very tired. Sleep helps your body fight infection. Avoiding sports. Physical activity can put too much pressure on an enlarged spleen, increasing the risk of rupture. You should avoid contact sports and strenuous exercise while you're sick and for up to 4 weeks after.